And my next terrific guest is Katherine Grill from Neolth. She is the founder, and we are going to talk about stress management. Hello, you're so beautiful. You don't look like you have any stress whatsoever.
Thank you. Yeah, well, it's my secret.
Exactly. I know this came out of a personal journey, so talk to me about.
Yeah, well, I'm a clinician, I'm a neuroscientist, and I had been working before in therapy and psychology and doing oncology research. And I just saw how devastating it was for patients to be diagnosed with something like cancer, for them and their family. And
Trust me, I know. As a stage 4 cancer survivor.
Okay. Yeah.
Yes.
So you get it. And you know, if we ask around the room, almost everybody would say they know someone in their family or friends who's been affected or they've been affected. And it's such a hard thing to deal with. And we had no stress management services. So we were working to build some in-person programs. But I really wanted to make something that was easy for the patients, more convenient, cheaper. And that's what led me to digital health and providing these services for the patients.
So how do you do it?
Yeah, well, we really work with the patients. They get a digital platform. It can actually be prescribed from the doctor, but the patient can use it themselves so it's up to them. And they get an intake form, and we'll ask you some things like what any diagnosis you have, any symptoms, what are some of your health goals. Let's just learn about you as a person and what you want to get out of this platform. And we built an algorithm that actually replicates the work of an integrative doctor. So you could work one-on-one with me, but that's so expensive, it's up to $500 an hour. So many people can't afford that. So now our algorithm works like a doctor. As soon as you do our survey, it's about 5 minutes, it's going to build you a personalized stress management plan you can get at home. So all sorts of audio, video, relaxation practices. They're all made by doctors. You can actually see each practice, which doctor made it, and link back to their work at hospital or university. You can tell us at the end of the month what was working, what you want to change, and we'll update that care plan for you, giving you new practices next month, a new practice schedule, and also progress reports.
So all this is done through an app?
It's all done, through our platform, and the basis for the algorithm is something called precision neuroscience. So it's a new field that we're pioneering. My background is in neuroscience, and it's the idea that we know through the neuroscience research what's going on in the brain when patients are having all these symptoms and stress. And we also know what's going on with the behavioral treatment, how they affect the brain and how they cause it to change. But unfortunately, behavioral health care hasn't really caught up to the science, and patients just get care based on what provider's close to them, who's convenient, what's affordable. Even other digital platforms, it's pretty standardized with 1 or 2 approaches. But we're really celebrating neurodiversity here, and from our intake, we're learning about you and your symptoms, what's going on in the brain, and we're connecting you to the right practices. So we say that we're giving wellness a scientific upgrade through this lens of precision neuroscience.
But you think how efficient it is, because I don't have to take an hour off from work to learn about my stress management. I can actually be doing it through Neolth.
Exactly. Yeah, that's the whole point, is how can we make it more convenient? And you know this, it's so stressful to be going through all the treatment, and you might not have a lot of energy, you might be fatigued or have different symptoms and pain. So how can we make this more convenient for you? You can do everything completely at home. You don't need to come to the hospital for more services. You don't need to pay for in-person work with a facilitator. You really just need to come for your treatment, and at home you can do all of this emotional health work.
And what does the measurement look like? Like, what am I seeing?
Some of the progress that we're tracking. So we ask you about things that are important to you, things that are relevant to your quality of life, things like your energy level and fatigue, things like your pain level, how well are you sleeping, how high is your stress. We'll also ask each individual for their main symptoms and how severe they are, so we can actually communicate that back with their provider. So it could be some mental health symptoms or physical health symptoms, depending on what's important to you. We also get to track things like which practices do you like? Do you like something like an art therapy, or do you like something like a guided imagery? What have you been using? What's your adherence level? And what do you want to continue to do in the future?
Dr. Grill, this is so personalized. It's just really personalized. I haven't really seen impact in the stress management area in such a personalized way.
Well, sometimes I think within the field of what we used to call alternative medicine and now we're calling integrative health, sometimes we don't always see a lot of science in these apps, and that was one of the things that really led me to leave my job at the hospital and build this type of program, because we want something that's scientific, that works for the patient. You don't have time to try out all these different programs and just test it out.
Yeah.
You want something that works
Not
for
when
you.
you're fighting for your life.
Exactly, you know, so we just want to make it easy for you, and again, it's based on not just the psychology and behavioral health, but really the personalization at the biological level and the individual differences in our brains.
I'm so excited for your work. Thank you so much for being with us at Startup Health TV.
Yeah, thank you so much for having me.
Thank you.